is Barbara Cathcart and I'm the Chief Executive of Nottingham Hospital's charity. I'd like to thank all of our supporters who helped us reach our £50,000 target for our long COVID research appeal, and we're going to meet one of them today, Ian Pointer. Firstly, we'll be hearing from Professor Charlotte Bolton, who will be the lead researcher for long COVID research here at Nottingham's hospitals.
Following the acute infection of COVID-19, many patients have persisting symptoms. These symptoms include fatigue, breathlessness, muscle aches and pains. For some patients it may be joint pains, for others it may be what's described as a brain fog, memory not as good as it was, bit of forgetfulness. But patients are describing a whole host of different symptoms, and each patient presents often with very different symptoms or different mixture of symptoms to others. The information on how many people are suffering from long COVID is still emerging. The reports from large databases suggest over 10% of patients have persisting symptoms and could be classed as having long COVID. Within Nottinghamshire, that could relate to 10,000 or more patients, but we're still accumulating, sadly, that information as to just how many are suffering. In order to answer the mechanisms and the potential causes for those symptoms, we're taking a very comprehensive approach. We're seeking patients to take part in a series of smaller projects, smaller assessments that begin to look at how the muscles work, how the heart works, how the lungs work, how the brain works, both whilst they're resting and then whilst they're doing some low-level exercise and activities, so that we can understand the muscle itself, the blood flow to the muscle, how the heart delivers that blood and hence the oxygen to the muscle, how the brain processes that, and how the nerves within the muscle and how the nerves from the brain to the muscle are in the people who are recovering from COVID-19. Alongside that, we're looking at strength, we're looking at the structure of the muscle, and we're also studying how patients absorb food and how the body metabolises that, so we can get a comprehensive whole body assessment and then determine how much is stemming from the muscle itself, how much may be because the patient's been fairly inactive as they recover, how much is from the heart, how much is from the brain, and piece it all together. The patients that are taking part in the research that we've set up are defined by having a hospital admission, so they had acute illness that was bad enough to need to come into hospital and needed quite high flow oxygen or needed support and intensive care. That's so that the patients are as well defined as a group as we can make it. However, the results of the study, which we hope will come to fruition in the next few months with the help of the appeal, will answer questions, pertinent questions, for many more patients suffering with persisting symptoms after COVID-19. But of course the research doesn't stop there. We have many patients who suffer each year with viruses or bacteria that causes lower respiratory tract infections or pneumonia. These infections can affect all ages, and indeed we sadly see many patients suffering in hospital with these infections. What COVID-19 has brought to the forefront is just how long it can take to recover from some of these infections for some people. The symptoms that many patients are suffering and struggling from is one aspect. But actually their recovery is bigger than that. Their determination to get back to how life was, to get back to full strength, to get back to work and jobs that they were doing beforehand, to activities that they were doing, and to living a full life with their friends or family is absolutely vital that we consider all these aspects and work with the patients as people. It's been a rapidly evolving clinical and research area, and I've been very grateful to the patients I've spoken with because they've driven the research agenda and the priorities of where we focus our work and how we do that research best. In order to do this research, we have accomplished a number of different research methodologies, and it's a big expectation for each patient, and we're really grateful for the patients taking part. The research works across different departments in the university and across different departments in the trust, and that collaborative working has enabled this. It works across the respiratory medicine department, across intensive care, with the imaging centre, the Sir Peter Mansfield Imaging Centre, and with the metabolic and muscle physiology group at the university. I want to finish by thanking the fundraisers, the supporters, those that have drawn attention to this appeal through social media, through conversations, through communication. We're immensely grateful for the support we've had, both financially and in communication and awareness.
Now I'd like to introduce Ian Pointer, who contracted COVID himself in March 2020 and has suffered from long COVID since.
I was rushed into hospital at 2:30 in the morning and then popped into an induced coma, and I believe March the 24th. For 5 weeks I was in a coma. Yeah, 4 to 5 weeks, I can't remember off the top of my head. It's a long time. 4 weeks I was in a coma, and then I spent 8 days on the COVID ward and the intensive ward. The problem is with long COVID, I stumbled across a quote from an American person who said that you get diagnosed with COVID. COVID is, we know COVID can pass within 14 days, 16 days, 21 days, whatever. Long COVID sneaks upon behind that. You're told that you've over COVID and everything should be the same, but your body doesn't feel the same. You still have the same aches, the same pains. And long COVID can sit with you, in my case, just in the back of your head. My functionality on my breath, my fitness came back, but my mental problems were still sitting there, and I didn't understand how much it was affecting me. So it's a really tough question to answer, other than I don't really, you know you've got long COVID until you understand that you're not really getting better, is probably the best way to answer it. And timescales can be for different people. The maximum is going to be 18 months because we've been in it for 18 months, but it could be 2 years, unfortunately, it could be 3 years, we don't know. It's just baby steps moving forward. The fatigue is always going to be there. Fatigue is the first caller, and breathlessness. I did, my lung functionality was fine. My fitness levels were down, but that could have been as well as through the time in the coma. But getting my fitness levels back, still struggled to walk more than 3 to 4 miles. As an ex-postie, I should be able to smash that out of the park, but I still struggle to do that. I have to take regular stops. And that lack of sometimes commitment to do something. Your mind might be willing to do it, but your body will say, yeah, crack on, and you haven't got that in you to do it. It's really hard to describe how you feel sometimes. And if you have a good day, you might go and do something like cut the lawn, but then it might take you 2-3 days to recuperate from that, which is not right, is it? You know it's not right, but it's hard to imagine living with it. Until you live with it, it's hard to talk about it as well, because there is no right or wrong answer. Different people are affected in different ways. I have my symptoms. Friends and other people I know have different symptoms. So there is no right or wrong way of dealing with it. There's no right or wrong answer to any of these. It's just how it affects you. So my colleagues, us posties, we do like to dress up, but I don't know why. It seems to be a thing. We've already done one fancy dress day. Sorry, tell a lie. We had one fancy dress day while I was in hospital. My colleagues did a fundraising while I was in hospital, and when I came out, actually a year later, it coincides with my birthday, so there's no hiding from that fact, but it could just coincide with my birthday normally. that we did another fancy dress day in aid of the city hospital charity. And I intend to keep it going. I intend to make it an annual event within my own DO, my own delivery office, but also, if possible, across the greater scheme of things within the Nottinghamshire area. It's just a good way of having a nice, happy, fun day for the children to look out for, because we dressed up as superheroes. It's been the theme for two of the events now. I think we need to change it to something else. But yeah, it's a good way of an easy way of collecting money and bringing the charity to the forefront, which is all it's all about. We saw a spike in the donations upon that time when we did it. We got a lot of media coverage. It's just a good fun day, and long may it continue. Long may it continue. We have other ideas in the back of our heads cooking away, so there might be some fun things coming up in the future as well. Without the NHS, I wouldn't have been here. That's brass tacks fact. Without the paramedics taking me to the hospital, without the doctors and nurses looking after me in the hospital, without the nurses on my ward making me laugh and keeping me sane, I would definitely not be here. Without the nurses looking after me 24/7, because at that time my family weren't allowed in the hospital. Without the nurses constantly answering the phone to my partner and reassuring her whatever time she phoned up, how can I pay that back? I would never, ever be able to pay that back. So the least I can do is to help the charities. The least I can do is to help the funding for long COVID. And I intend to help Nottingham hospital charities as long as I'm around. It shouldn't be just I do it this time because they've helped me. It should be there, well, it will be there. It'll be there while I'm able to draw breath. I will try and do something to help this charity. That's my commitment.
One of our biggest fundraisers was Sanjeev Sharma, who contracted COVID in March 2020 at the beginning of the pandemic, and since went on to climb Mount Snowdon with his friends and family to give back to the hospitals, who he said were like family to him when he was recovering. We are indebted to him for the huge sum of £40,000 which he has donated to Nottingham Hospital's charity. Thank you to everyone who's donated to our long COVID research appeal. Your generous donations make a world of difference to patients across Nottingham and beyond. Our initial target of £50,000 will enable us now to get on with this important research. Any ongoing support will be well used to support long COVID research in Nottingham, and we appreciate everyone's continuing efforts in this ever-burgeoning field for which no one really has the answers yet, and your donations help us get there together.